Welcome to another episode of the Healthy Living Resources telecast. Today we'll discuss what we know about current COVID-19 medications, and we're also going to take a deeper look into the different types of treatments available, as well as share helpful information if treatment is needed. Stay tuned. Welcome to another episode of the Healthy Living Resources telecast. Today, we will discuss what we know about current COVID-19 medications, and we'll also take a deeper look into the different types of treatments available. We're also going to share helpful information if treatment is needed. We have with us today Amy Meehan, our Healthy People Program Specialist from OSU Extension, and several guests that she has brought along with her. So welcome. Thank you all for being with us today. And can you please take a moment to introduce yourselves to our viewers and tell us a little bit about your roles and what it is you do. And Amy, we'll start with you.
Thanks so much, Rae. We're very happy to be here today. Like Rae said, I am Amy Meehan, the Healthy People Program Specialist with OSU Extension Family Consumer Sciences in the state office. And today we have some folks from the pharmacy world joining us. And so I'd like to pass it off to Miriam to introduce herself next.
Hi, everyone. My name is Miriam Shahida. I'm a pharmacist and a professor at The Ohio State University College of Pharmacy, and I also serve as Director of Pharmacy Extension and Public Health Initiatives. I work in OSU Extension to connect county offices and Ohioans with the wonderful resources that your local pharmacist can provide. I have two pharmacist guests with me today who will help us understand more about COVID-19 therapy. Let's start with Andrea.
Hi, everyone. My name is Andrea Kowalski. I'm a pharmacist and the Director of Clinical Services for Shrivers Pharmacy. We are a multi-location independent pharmacy in Southeast and North Central Ohio. I oversee the development and the implementation of different clinical services across all 8 of our pharmacy locations. These range from everything from MTM to different pilot programs that we're in. And as you can imagine, the majority of my focus over these last 2 years have really been centered around the pandemic and really equipping our stores to handle COVID testing, vaccinations, and COVID treatments. So I'm really excited to be here today to talk about what our current available options for COVID treatments are. So thanks for having me.
Hi, I'm Jen Sabatino. I'm an ambulatory care pharmacist working in primary care. So the same office that you go to see your family doctor is where pharmacists like me work alongside your doctor to make sure that you're getting the most from your medicines. I work for the Ohio State University General Internal Medicine clinics. We have 8 clinics across central Ohio providing care for more than 50,000 Ohioans annually. And one of my roles during the pandemic has been developing and implementing a pharmacist-run program to ensure timely access to the treatments that we'll be discussing today for all of our patients who are COVID positive and meet criteria for treatment.
Thank you for those introductions. Let's go over to the topic at hand. Of course, the COVID-19 pandemic has continued way beyond any of our expectations, but the good news is that there are vaccines available and therapeutics available for patients to use. So my first question is to Andrea. Andrea, what oral medications are available for COVID-19?
Sure, so we'll jump right in. So right now, there are currently 2 oral antiviral medications that are available. The first one I'll kind of talk about is called Paxlovid, which is made by Pfizer. It combines 3 capsules that you have to take twice a day for 5 days. So we know that when you get infected with a virus, the virus's main goal is to infect your cells, to replicate and spread. So Paxlovid works by slowing down that viral replication. It actually stops one of the virus's tool called an enzyme, and it stops it from replicating itself so that your immune system can clear that virus out of your system. This treatment has been shown to have about an 88% reduction in hospitalization and death when compared to placebo. So that's actually really high, and it's very highly effective. The second treatment that's available, it's another oral antiviral. It's called Malnutrition. That's a capsule that's made by Merck. So this treatment is also a pill series. You take 4 capsules twice a day for 5 days. So going back to, thinking about how a virus works in your body. So this medication works a little bit differently. When the virus is trying to replicate itself, this medication will interfere and insert different mutations into the virus. So essentially the virus is creating a copy of itself that's weaker. And then your immune system can clear that faster as well. Malnutrition has about a 30% reduction in hospitalization and death when compared to placebo. So it's a lot less than the Paxlovid, but it's still a really great option for those patients who are high risk.
Thank you for that helpful overview. So say I have COVID. What are my steps to take to get this medication, either Paxlovid or Molnupiravir?
Yeah, so there's a couple different scenarios. Obviously the most easiest and convenient way that this would happen, would be that you went to your doctor's office, you got a COVID test done, you tested positive, and then your doctor can write you a prescription, and you would just need to have it sent to a pharmacy that carries either one of those antivirals. While that's probably the most convenient scenario, it's probably not the most common. Most people probably fall under the second bucket where, you've tested positive for COVID at home. You may not have a prescriber who can write a prescription for you, or you may just not even have a prescriber at all. So what you'll want to do is utilize a search tool that is online. It was created by ASPR, that's the Assistant Secretary for Preparedness and Response. There's not an easy URL link to tell you, but you can simply Google antiviral test and treat centers near me, and it'll probably be one of the first links that pops up. So this will be a map that you search by your zip code. It'll give you all the locations closest to you that you can get a COVID test at, what pharmacies have that treatment available. And some locations even have options to have a telehealth doctor visit for you to get you that treatment as well. So going online and using that locator tool is the first step for finding a way to get treatment. And then depending on your situation and what treatment options are for you, you can go from there.
Wonderful. Thanks so much for sharing that. Really appreciate having both perspectives because, like you said, it could be different depending on each patient. So is there anything that you need to ask your doctor before you're able to get a prescription?
So when getting a prescription for an antiviral, there are a few pieces of information that are really important for both your prescriber and the pharmacist to know. So I'll kind of run through those things. First, in order to be eligible for treatment, obviously after testing positive for COVID, you need to start treatment within the first 5 days of symptom onset. So it's really important to know what day your symptoms started. Also, there are quite a few drug interactions with Paxlovid, so you want to make sure that your medication list is up to date. If you're filling at a pharmacy that's not your regular pharmacy, you'll want to make sure that they have access to that information to check for interactions. And then also, if you have any type of kidney disease or kidney impairment, you may need a dose adjustment for the Paxlovid. So you'll want to make sure that both the doctor and the pharmacist are aware so that they can prescribe the correct dose for you.
So you mentioned a lot of interactions, Andrea. If a patient is on other medications, what do they need to know?
Yeah, so, Paxlovid is the antiviral that we know has the most interactions. Again, there are a couple different scenarios. First, you could be taking medications and totally be fine to take Paxlovid with them. That's the easiest scenario, obviously. Also, there are some medications that might need to be stopped while you're taking the Paxlovid for those 5 days. It's okay for you to stop certain medications, for example, cholesterol medications that interact. Your doctor will decide if you're able to stop certain medications while taking it. Obviously don't stop taking a medication unless your doctor tells you to stop during that 5-day period. And in the last scenario, also, some medications absolutely cannot be taken with Paxlovid. the interactions outweigh the benefit of taking it. So in this case, your prescriber will either choose Malnutrition or another treatment course for you. So it's really important that both your prescriber and the pharmacist are aware of your medications so that you can get the best treatment for you.
Wonderful. Thank you. This has all been such phenomenal information so far between these two different medications. And so one question I want to be sure to ask that I'm sure our viewers will be very interested in, what side effects could be expected with either of these two medications?
Sure. So unfortunately, there are always the risk of side effects with medications. And, you're already not going to be feeling very good just having COVID in general. So some of the side effects are kind of similar to maybe what you're already experiencing with COVID. But for Paxlovid, the most common side effects we see are alterations in taste, diarrhea, hypertension, and some muscle aches. And with the Malnutrition, the most common reported are diarrhea, nausea, and dizziness. So again, it might be kind of hard to tease out if it's the COVID or if it's the medication, but either way, lots of rest and taking these medications will get you feeling better faster.
Andrea, thank you so very much for the insight you've given to us on COVID-19 oral therapeutics. If patients who are listening have any questions, feel free to ask your local pharmacist. I'm sure they'll be able to provide additional insight. Let's go on over to other types of treatments available for COVID-19. A lot of folks mistakenly believe that there are injections available, but there are actually infusion therapies and injectables that are available for patients to treat COVID-19. So we'll go over to Jen now, who will answer a couple more questions around this realm. Jen, what are other treatments available for COVID-19?
So in the outpatient setting, we have a preventative therapy for COVID called Evusheld. And that would be for people who have not yet been exposed to COVID, but they have a weakened immune system. So maybe they can't develop an immune response to the COVID vaccine or can't receive any of the COVID vaccines. So that's a medicine that we can use in that case. Then we have an actual treatment called Beptilovam for people who have mild to moderate symptomatic COVID infection, intended to reduce the progression to severe COVID infection and hospitalization. Both of these treatments that I just mentioned are monoclonal antibodies that have been authorized for emergency use by the FDA. Monoclonal antibodies help your immune system recognize and respond more effectively to the virus. So when you're infected with a COVID virus, your body is going to start producing its own antibodies, but it takes some time to do that. So in this way, we give the antibodies early on in the course of the disease, and they can start working right away. The FDA determines which monoclonal antibodies are authorized for use according to the changes in the COVID variant that is prominent, and the Ohio Department of Health allocates doses of these medicines based on supply and demand at the various facilities that can administer them. Because the government purchased a supply of these monoclonal antibodies, they're often offered without cost for the medicine. Then there's a third agent. It's an antiviral injectable medication called Remdezvir that the FDA approved under the brand name Veklury. It was previously only used in hospitalized patients and has more recently been approved for use in non-hospitalized patients. It works by interfering with the ability of the virus to make copies of itself. So similar to the medicines that you can take by mouth that are antiviral, this medicine works in a similar way. It is an FDA-approved commercially available medicine, so use of this medicine might have a cost associated, like other commercially available medicines.
Well, thank you so much for explaining those. So let's say I test positive for COVID. Am I eligible to get these injectable treatments?
Potentially. So the National Institute for Health's COVID treatment panel recommends use of those antiviral medicines that you can take by mouth over the use of the injectable monoclonal antibodies when available and when appropriate to use the ones that you can take by mouth, because there's more evidence for effectiveness, like Andrea described. So in instances where there's not a contraindication to using a medicine like the Paxlovid, that would be preferred over the monoclonal antibody injection. Veklury is also a preferred treatment because it has more evidence available for its effectiveness, but it can be more cumbersome to coordinate the administration of Veklury. And there's likely, like I mentioned, a higher cost associated. So Veklury is more commonly used for COVID positive patients who are in nursing or healthcare facilities and can receive the infusions. But for those people who cannot take Paxlovid, Beptilovam may still be an option. Another thing that I want to be sure to emphasize is that these treatments are only considered to be effective in a certain time frame from the start of your symptoms. So it's really important to test at the sign of symptoms and then seek treatment right away in order to improve the chance not only that you'd be eligible for one of these treatments, but also that the treatment will be effective. So in order to receive the Beptilovam for treatment, you need to be older than 12 years of age and weigh more than 88 pounds. Veklury, the FDA-approved treatment, can be used in adults and children as long as they're older than 28 days and weighing at least 6.6 pounds. So Veklury is the medicine that's a treatment option for people younger than 12 years of age. In either case, as long as you meet those age and weight requirements, you must have a positive COVID test, have mild to moderate symptoms of COVID for less than 7 days, and be at high risk of progression to more severe COVID symptoms or hospitalization. So your doctor will determine if you meet criteria for being high risk for progression of COVID symptoms. Some of the risk factors that that includes would be obesity, kidney disease, heart disease or high blood pressure, lung disease, being older age, having a weakened immune system, having diabetes or pregnancy. And again, that's something that when you seek treatment from your doctor, they would evaluate whether you meet that criteria for these treatments.
Thank you for that detailed response. I think folks who are listening will find that information useful as they're trying to decide what type of treatment they're eligible for. So a lot of patients have come to me, and I'm sure they've come to you as well, saying that they have a fear of needles. What can a patient expect if they're coming in for infusion therapy or for injectable therapy for COVID-19?
So injectable infusion therapy is going to involve needles, but I will say that the treatment centers that are giving these treatments are typically hospitals or infusion centers where the medical team is experienced in making the injection or securing the IV access as comfortable as possible. The first therapy that I mentioned, which is a preventative therapy for people who have not yet been exposed to COVID, Evusheld, is given as 2 separate injections into the muscle. So an injection similar to what you get with the COVID vaccine, but the preferred site is your gluteal muscle in your bottom. So you get 2 separate injections in the muscle of your bottom, and then you're observed for an hour afterwards for any adverse effects. The monoclonal antibody treatment, which is one of the most available infusion injectable treatments for people with COVID symptoms, is a single injection into the vein. So a healthcare provider would place an IV line, give the injection into the IV line over at least 30 seconds, and then again, you'd be observed for 1 hour after that treatment is administered. And then that antiviral therapy that the FDA approved for people with COVID symptoms, the Veklury or Remdezvir, it's a 3-day course. So it's an IV infusion, not as an injection into the IV line, but an actual IV bag that's infused over 30 to 120 minutes daily for 3 consecutive days. And again, after each 30 to 120 minute infusion, you're then observed for a full hour. So that's the most time and resource intensive treatment option.
And so now we know if we're eligible, what the treatments are kind of like. But now the next step would be, where could I go to get an injectable treatment for COVID-19?
So according to the Ohio Department of Health, the monoclonal antibody treatments are available at over 300 healthcare locations across the state. And the same resource that Andrea recommended from the Assistant Secretary for Preparedness and Response has that map that shows all the different facilities that are able to administer the Beptilovam and also as specific as how many doses they were allocated by the state. So you can enter your zip code and you can find those locations in your area. Again, Veklury or Remdezvir is that FDA-approved option, so it's not allocated to treatment sites by the government the way the monoclonal antibody is, so it's not listed on those treatment locators. In Ohio, a prescription or a referral is required from a physician in order to receive that monoclonal antibody treatment. And your doctor will likely be familiar with the process for getting you access to that treatment if you're eligible. If you don't have a doctor, though, you can call the Combat COVID Monoclonal Antibodies call center at 877-322-6585 to find out who to talk to about your symptoms and how to get treatment.
Those are really practical resources, Jen, so we're very grateful that we can share that with our listeners today. Like we asked Andrea on the oral therapeutics, what kind of side effects should a patient expect if they're getting an injectable or an infusion therapy?
Monoclonal antibodies are being used under emergency use authorization. So these haven't had received the full FDA review and are still being studied. But side effects from these treatments have been minimal to this point. The most common side effects of Beptilovam, that monoclonal antibody infusion for treatment of COVID symptoms, have been nausea and vomiting, and the incidence is less than 1% of people who receive that medicine. So less than 1 out of every 100 people who receive it experience that nausea and vomiting. The most common side effects of Veklury, the FDA-approved infusion, include nausea, headache, diarrhea, fatigue, and dizziness, and those incidence rates are 1 to 10%, so 1 to 10 out of 100 people who receive the medicine. Allergic reactions and infusion-related reactions can happen during and after an injection or an infusion, which is why you're monitored for an hour after administration of any of these medicines. And then anytime you're receiving a medicine by vein, or like the Beptilovam or the Veklury, or by an injection into the muscle, like the Evusheld, you can have injection site reactions or injection site side effects. So brief pain, bleeding, bruising at the site, soreness, swelling. And then anytime you're going through the skin, there's the small potential for infection as well.
Let's transition to some general information around pharmacy. It's not often that we have two pharmacists with us, and so I really want to pick your brains on general pharmacy information as well. So I'll start with Andrea and then I'll move on to Jen. What information should a patient bring to a pharmacy before being treated for COVID-19, or even more general to that? What information should a patient bring in aside from a prescription, maybe when they're coming to see their pharmacist?
Sure, that's a great question. Getting a prescription for these antivirals at your regular pharmacy doesn't really require a whole lot extra. I think for most people, if you're going to a pharmacy that's not your regular home pharmacy, making sure that you have your insurance card with you, like I mentioned before, a medication list, so that the pharmacist can check those drug interactions. And then also, I think something that gets maybe a little bit overlooked is in any pharmacy setting, if you are picking up medication for yourself, whether you have COVID yourself or a family member is picking it up for you, just make sure that you're paying attention to how you're supposed to pick up that medication. Our goal is to get you healthy and feeling better, but also to protect our other patients who are in the pharmacy. So just making sure that you know if you are supposed to use the drive-through only, or call from the parking lot and have your medications brought out to you. I think those are probably the few things that I can think of that would be different than just picking up a regular prescription.
And Jen, when you are seeing patients in your location, it is a little bit different from a local pharmacy. What things should a patient be prepared to bring with them when they come to see you?
So in my locations, again, I'm in a primary care office, so I will see patients for visits one-on-one for their chronic diseases, such as high blood pressure, diabetes. Sometimes we'll do medication reviews and have you bring all of your medicines in, and we can go through everything and make sure you're getting the most out of your medicines. So bringing that medication list or those pill bottles with you. In the context of the COVID treatments that we were talking about, so a little separately from the medicines you can take by mouth and get at the local pharmacy, when you're either having the conversation with your doctor about your eligibility for these infusible, injectable medications, or when you go to the site to receive them, the other things that I would say to bring would be any history of allergic reactions, especially to medicines that are administered by injection or by infusion, and then also any questions that you have. So particularly the medicines that are not FDA approved, but are being authorized for use in the emergency situation by the FDA, your doctor and the treatment team have to review that emergency use authorization with you and answer any questions that you have before you get the medication.
I'm going to close with a final question that I'd love to get both of your insight. What is one thing you wish the public would know about their pharmacist, specific to your practice setting, but in general as well? Let's start with Andrea.
Yeah, so I think my thing will just be specific to COVID, because I think there's probably a lot of things that I would like to share about pharmacy and all the great things that we do. But I think one thing I want patients to know, is as your pharmacist and part of your healthcare team, our priority is to help you feel better. And our priority is to get you the right medication in a safe and timely manner. But we need a lot of patience because right now we are doing all of these things in addition to our normal pharmacy work. I think that the pandemic and COVID really changed the landscape with the way a lot of businesses are run and a lot of ways that processes are carried out. But one thing that it didn't change was our normal pharmacy workflow and daily work. So, this is something that we're doing on top of all of that. And we are so happy and so privileged to be able to be part of that treatment team. But just remember that when you're going into your pharmacy, just having a little extra patience and grace with the team so that we can get you in and out and feeling better as quickly as possible.
And I guess I would just add, I'm happy to be here to share where I work and what my role is and how it's different than what the public might immediately picture when they think of a pharmacist. So pharmacists complete 6 to 8 years of college. They complete a doctorate degree. Some of us complete 1 to 2 years of postdoctorate residency training, and pharmacists work in all kinds of environments. We are appropriately recognized as healthcare providers in the state of Ohio, and we're one of your most accessible healthcare providers. So you've got your community pharmacist who helps you with your medicines on the dispensing side. Many of you probably have a pharmacist in the primary care office, or you see your doctor or your nurse practitioner as well as a pharmacist. And then there's pharmacists on your hospital treatment side if you're in the hospital setting. So I guess I just want the opportunity to increase awareness that pharmacists are everywhere, and we're your drug experts and happy to help you understand your medications better.
Thank you all so much for all of this valuable information. It was wonderful having you join us, Miriam, Andrea, and Jen. I want to close out real quick by just mentioning to all of our viewers that we will include all of the resources that were mentioned today, the websites and the phone numbers in our credits. And then one additional component that I'd like to add is that if you are not already aware, you are able to receive free at-home tests through the U.S. Postal Service, and we will also drop that link in the credits as well. And now I will pass it to Rae to wrap up the telecast for us. Thank you again to all of our guests for being here. We really appreciate it.
Okay, thank you so much for your time today. And if you viewers have any questions for us, please do not hesitate to reach out. Our contact information is listed in the credits, and please feel free to contact your local county extension office to get connected with all the great resources that we offer. Thanks for listening, and we'll see you next time.